Hey guys, Dr. Derry here today. So of course I'm with Claire. We're both doctor of physical therapists and we're working through our favorite stretches for those with lower back pain. And so we're gonna go over 13 of our top stretches. Now I know that's a lot. That's because these are our go-to exercises that we have found over time to help people who have lower back pain and discomfort. And you may have heard some of these before because they are the go-to exercises for many therapists. But what we want to do is maybe provide a little bit of nuance and a little different way of thinking to maybe help you get over the edge and improve some of that back discomfort with these stretches. So hang with us. We're going to go through all 13. Some are going to be lying down, some are going to be standing. Just go through, learn the form, and then look in the description for the dosage, so the reps and sets that we typically do with patients. And so hang with us, here we go, and let's have some fun. Okay, so our first one here is a hamstring stretch. So the hamstring attaches to the pelvis and it can definitely play with some of that lower back discomfort. So let's go over the hamstring stretch. We love to use this little nylon strap here because it doesn't have any give to it. It's nice and strong, and so when she goes to pull and lift that leg up, she can use the least amount of arm strength as possible because you're gonna have to hang out there for a little bit. So it's gonna go around the arch of her foot, and what she's gonna do is grab a loop with her hand and then around the arch, and then she's gonna give herself a good pull and then a relax. And so you don't have to relax all the way down, but a good pull and relax. A good pull and relax. So it's a great stretch. You should feel that from the entire hamstring, maybe closer to your knee, maybe in the middle of the thigh. It's really different for everybody. So enjoy that stretch. It feels really good. Good, nice pull. Awesome. And so you can vary that hold a little bit, 1 second to 3 seconds. If your arms start to get tired, then just relax your leg all the way down. There's really no rush here. So we're gonna move on. We're gonna go right into the glute stretch. And so the glutes are huge muscles that help provide strength and support for our core and our lower back. And so we're going to stretch her right side here. She's going to pull with her right hand, or she's gonna stretch her left side, sorry. She's gonna pull with her right hand over towards her armpit area, and that's gonna hit the nice glutes off to the side. And so a good pull and then relax, a good pull and then relax. And so you're gonna see a theme. I don't really like to do the prolonged holds. They're heavy on the arms at times. And you know, I have found the good pull is enough to get some change without having to hang out there and just think more is better. I don't think that's not necessarily the case. And so we're gonna pull and relax, pull and relax. So she's enjoying that nice glute stretch, and you should feel that right into the meat. That's exactly what we're going for. Okay, so we're gonna go right into the piriformis stretch now. So she's going to, let's stretch the other side since she's been working on this one. So let's go to the right side here. So she's gonna cross her right ankle near her, the middle of her thigh, maybe towards her knee a little bit. And she's gonna lift up and grab behind her knee. If you have some knee pain, grabbing behind the knee is a great way to do it. If you don't have any knee pain, you can grab on top of the knee. It really doesn't matter. And you're just gonna pull until you feel that good stretch in the right side. And so the key here is trying to get this knee on top of your pelvis, if not more. And everybody's hips are built differently. So you're gonna have a good pull and then relax. And that relax is just a little 1 inch difference there. So she could probably feel a good stretch there and then nothing there. And then a good stretch there and nothing there. And so just listen to your body, pull into that limited range, enjoy that nice stretch, and then get out of it. You don't have to relax all the way down, but give your body enough time to just kind of enjoy the stretch. And so those are 3 so far that we've done that are just really go-to stretches for those with lower back pain. These stretches do help, but the dosage is different for everybody. The range of motion is different for everybody. So our goal here is just to expose you to the exercises and stretches, but then you kind of figure it out on your own and what your body is best. So we're gonna keep moving here with some of our favorite stretches. Okay, so we're gonna stay on the plinth here or the table. You could do this on the floor in your bed, but we're gonna go right into the pelvic tilt. So the pelvic tilt, if you can imagine, you're gonna tilt your pelvis backwards. And so what we look for as therapists is people can get rid of that space in their lower back. And so you naturally have a little bit of lordosis or a little curve, and you wanna eliminate that space with this tilt and then relax the other way. And then tilt back and then relax. A great stretch. We've went over this in prior videos. It's great to do in the morning, but this is one of the go-to stretches for lower back pain. A million therapists have done this a million times, and I think the nuances make all the difference. And so reducing that space in your lower back, knowing it's not a core strengthening exercise, the intent isn't core strengthening right now, so not the hardest contraction you've ever done in your core, but learning how to engage your lower back is important to get that good stretch, but also moving forward for the rest of your care. So get that good mobility, learn how to do that pelvic tilt, learn how to eliminate that space in your back. And there are many, many ways to progress it, but this is the foundation. Looks really good. She has a good pelvic tilt. And then moving on from the pelvic tilt, we're gonna go right into the bridging. And so some people may not think this is a stretch, but I promise you when you lift up your hips, you're gonna feel a little stretch into your quad, and then you may also feel a little pressure in your back. And so she's going to lift up her hips, and she is going to bridge right there. So you may feel some tension here. Now, the variety here is everybody's hips are built differently. So you may have a wider stance, you may have a more narrow stance, that's fine. You may lift up again. And let's say you have discomfort at this range, well, just go right before it. Flirt with that limitation, don't move past it. And so we're gonna go over the dosage in the description, so don't worry about that right now. Get the form down. So drive with your heels, feel that contraction into your glutes and hamstrings, and then feel those quads kind of relax and stretch. The quads and the hamstrings attached to your pelvis. So their interaction with your low back is very important. That's why it's called the lumbopelvic complex, because they're very much related. And so when we treat lower back pain, we have to do stretching for everything that attaches to it, if that's appropriate for you. So when you try this out and see how it goes. Moving on to the next one here is called lumbar rotations, and she's gonna rock her knees side to side. Now, you may have done these in the past, and you should. I think a lot of people do this just to loosen up their lower back. For her, she has good range of motion. You don't want to force it. You just want gravity to kind of take you there, and so you can enjoy that good stretch. So if she rotates to the right, she should feel it on her left into this region here. If she rotates to the left, she should feel it on the right. And that's typically how it goes. Now, if you have a little bit wider set feet, that's okay. You can enjoy that nice lumbar rotation and still get a good pull out of it. It's really up to you. Everybody's body is different. If you rotate and you feel any groin discomfort, well then just avoid that range of motion. We don't want any groin discomfort with this. This does loosen up the hips fairly well, but we don't want to have any hip discomfort at that same time. And so enjoy that good lumbar mobility and hip mobility with this lumbar rotation. Okay, so now we're gonna go to our favorite side lying stretch. So she's gonna lay on her side. Doesn't matter which, we're gonna just go over form here. Okay, so she's gonna bend her knees up, and then now she is going to rest her hand underneath her head, but let's pretend she has a pillow. And so go ahead and use your left hand on your knee here. Right there. So she's gonna lock her knees down, and then she's gonna open up with her right side to try to get that whole lumbar and thoracic and cervical mobility. So what you can see is that she's moving her head, getting the cervical spine, she's opening up her chest, hitting that thoracic spine, and then since everything is moving together, that lumbar spine is gonna be the last segment to move. A little tip here is that make sure you breathe out at the very end. And so when she rotates all the way to the end, you should see, or at least she should be trying to breathe all of her air out so she can get that full rotation of her thoracic spine. And so when she does this on the other side, it should feel very similar. I love doing this for people who maybe have stiff upper back, lower back, and necks, because it hits the entire spine, and we often don't work into that rotational range. And so rotation is important. Your body is meant to do it. One of our favorite lower back stretches to gain some rotation. Okay, so now we're gonna transition to hands and knees. So she is gonna do what's called an angry cat, and she is going to arch her back here. And so she's gonna get a really good thoracic flexion, lumbar flexion, and then just relax back to the middle. Good, and what you should just see is a round it out. So she should just try to round things out and then relax. Our backs tend to like flexion going forward more than they do extension. So this flexion stretch can help you gain some range of motion and mobility, but also give you some pain relief along the way. One of our go-to stretches for lower back. Many other therapists love doing this as well. If you do this already, awesome. The only caveat here I would say is if you're gonna get a little bit more, if you try to get that little bit of ab contraction at the very top as well, so drive through your arms and then get that ab contraction and get that angry cow position, or angry cat, not angry cow. Definitely don't want an angry cow. All right, so now we're gonna go into a prayer stretch or child's pose. So she's gonna spread her knees a little bit and just sink down into that range. And so you should feel some lumbar mobility, lumbar flexion here. And the reason why you get lumbar flexion is because you're locking out your hips. And so she is bringing her knees as close as she can to her chest so she can make sure that range of motion is coming from her back, which is super important. And so that's a hard thing to learn sometimes, is to learn how a stretch in your lower back should feel. but to really get a good lower back stretch, you want to lock out the hips. And so that's what she's doing. Some people's knees are a little closer together, some people a little further apart, but she's going to rock into that position, have a good breath out. And this is one of those stretches that I give you the choice. Like if you want to rock into the range, great. If you want to get there and hang out for a minute, that's fine too. You know, this is a great position just trying to gather your breath, especially if you've been working out or feel stiff. You can just hang out into that range and enjoy that really good stretch. We've gone over quite a bit of lower back stretches so far. We still have a few more to go. That's some of our favorite as well as other people's favorites. But I hope you're getting something from it. And if you guys want to show some love, subscribe to the channel, it'd be greatly appreciated. Leave some comments down below the description. Let's engage a little bit, make sure everybody's getting better. Okay, so now we're moving on to a prone press. This is very common. This has helped to stretch out the lower back. And there's a couple key things here. So one, she's gonna press up. Her hands are gonna be just outside her shoulders. Even if they're up a little bit, that's okay. If you have some shoulder discomfort, you may just start on your elbows. And so that's fine as well too. And so she's gonna be right there. We wanna feel it here. So she's gonna press up until she feels it there. Now your first rep, you're probably not gonna be as high as your 10th rep, okay? So she's gonna press up. And the key to remember here is breathing out. Relax those lungs so you can get that further into the range and you can enjoy more of that stretch. It's super important. She's gonna press up. Again, the dosage is gonna be in the description. Great, she's getting good lumbar mobility here, keeping those hips nice and relaxed. And the key thing to remember here is you don't want these hips coming off the table or the floor, okay? Remember that to get that full range of motion and make sure your back is relaxed, hips don't come off the floor. All right, so our last few here, we're gonna go into standing and sitting. Here we go. All right guys, so we're going into one of our favorite seated stretches. The Swiss ball here, the exercise ball, is very helpful because she's gonna put some weight into it to get that stretch in her lower back. So this is good for people who are maybe a little bit more stiff in their lower back, maybe been diagnosed with stenosis, a perfect stretch that you can do in seated. So hands are going on the ball and she's just gonna breathe out and relax into that range so she can get that good lower back stretch. And so a key here is that you wanna make sure your knees are spread apart enough so that ball can fit and that you can roll out and feel that really good stretch. A couple more times here. So roll out and breathe out and enjoy that stretch. Good, perfect, great form. So we're gonna move on to some of our standing exercises. Okay guys, our last two here are in standing. So she is going to go into a hip flexor standing stretch and one of my personal favorites. And so she is going to have a good lunge here. And then she is going to, what she's gonna do is shift her weight forward, not lean forward. And so leaning forward is here, and then come up, and then shifting your weight forward is there. So she can get that elongated hip flexor stretch, and then she is going to rock into that motion and then come back. Rock into that motion and come back. And what you can't see is your feet, and it's completely okay that the back foot and that heel comes off the ground. Don't try to keep that heel on the ground. If you don't have that mobility, that's okay. It's not the intent. The intent here is to stretch that hip flexor quad so you can feel that good stretch because the hip flexors originate in your lumbar spine, so you want to loosen those suckers up. Good. Little key here is that she is going to rock into that stretch and then she's going to turn a little bit and then squeeze her left butt cheek here. So once you squeeze that glute, the hip flexors have to relax. That's how your body works. They work in a way that in order for one muscle to contract, the other ones have to relax. And so once you squeeze that glute, you're gonna feel a huge difference. And make sure you are safe. If you need a chair next to you or you do this next to the wall, that's 100% fine. But this is one of those stretches that you could do anywhere and enjoy that good hip flexor stretch because those hip flexors can get tight at times, especially if we sit more than we like. All right, last one is going to be a new one for me, for sure. So she is going to do a squat with rotation for the lumbar spine. And in a sumo squat position, so a nice wide stance, hands braced on her knees, and then she is going to rotate side to side. And what that does is it helps you get a nice hip stretch and loosen up that lumbar spine. And so one of these stretches, maybe this last one, it may not be appropriate for everybody. So get into that nice good stretch and then rotate. If your balance isn't great, then don't try to do this. And if you have any discomfort, please consult somebody. I don't want you to have any discomfort. So she is just nice, getting a nice stretch. And I've seen people do this before and get a nice crack in their lower back. And if that happens, that's good. Just enjoy that moment. Feel that good pop in your back. Awesome. All right, so We went over 13 stretches. And so if you did all 13 of those, you're loose as a goose right now. You're feeling pretty good. If you didn't do all 13, that's okay too. It's not the intent. We don't do that many stretches in one session with a patient either. So we just want to expose you to how we kind of talk with our patients and kind of go through the form and go through how it should feel, because that is important. I don't ever want to feel, or I don't want anybody to ever feel like they're not getting relief from it and not experiencing what they should experience. And so if you have any questions, reach out to the health professional, the movement professional that you're working with to help you with your lower back discomfort, or leave some comments underneath the description. We'll get back to that. Appreciate the support, guys. Please subscribe if you feel like you want to keep following this type of content. And as always, guys, stay healthy, keep moving, and take care of yourself.